Thank you for being here. Thank you for being here. Yeah, I was a teacher for 35 years. I can still get a class to be quiet. We are gathered here today as leaders from area retiree, advocacy, and healthcare organizations, along with the District Director for the Honorable Keith Ellison. We are here to address the issue of yet another special break for the pharmaceutical drug companies. Yeah. So I'm Dan Michael. I'm the president of the Minnesota Alliance for Retired Americans and the president emeritus of the Minnesota State Retiree Council, AFL-CIO. And I wish to make 3 points today. Number one, is well known to all of us that no matter really at what age we begin, as we age, we have more and more contact with the healthcare system. Some of you are earlier on that road than others. You know, we have our cardiologists, our endocrinologists, our ophthalmologists, orthopedic surgeons, and others, oral surgeons. We have more and more contact with healthcare organizations, and our contact is more than just the annual flu shot. It's more than just the annual physical. And when we leave whatever office that we're leaving, our usual next stop is the pharmacy. And we find out how costly the drugs are, both for very specialized items as well as our maintenance drugs that we have. So that's my first point. Second point, October 15th is coming up, and that's the open enrollment period for Part D. I don't know if you got greetings in the mail last week with the drug prices. My wife's drug prices are going up 33%. At the same time, the company is increasing its deductible. So we're going to be paying more in premiums for less coverage. My own drug company, Part D coverage, is going up 43%. 43%. And I'm going from a $0 deductible to a $250 deductible. So again, I will be paying a whopping sum more and getting less coverage. And we'll be calling the senior linkage line shortly after October 15th. To find out where else can we go. Where else can we go? So that was point two. The pharmaceutical companies, want to be exempt from a patent process, but other speakers will tell you more about that. So my final point, I'm proud to report that the Minnesota State Retiree Council, AFL-CIO, at its convention, September 23, not too long ago, voted to oppose the carving out a special privilege for Big Pharma, and that our motion be directed to the state AFL-CIO for its consideration and action. That's our process that we go through. So we're on this. We're on this. So at this time, I'm honored to present Jamie Long, who is the district director for the office of Congressman Keith Ellison, excuse me. I almost said John Klein. Amidst all these nurses, I'm really not feeling well today. Keith Ellison. Keith Ellison, graduate of U of M Law School. First elected to the U.S. House in 2006, the co-chair of the Progressive Caucus and chief deputy whip in the Congress. When Congressman Ellison was first sworn into Congress, he said he intended to focus on wages, housing, and relief and justice for the middle class. He has never wavered from that commitment. So I'm pleased to present Jamie Long from Congressman Ellison's office.
Thanks very much. The congressman didn't get to his nursing care quite in time, so he's flat out on his back today, but he's resting up, drinking lots of fluids so he can get back to Congress and keep up the fight for all of you tomorrow. So. And he asked me to be here to read a letter on his behalf on this important issue we're talking about today. So here goes. Dear nurses, seniors, and retiree advocates, Americans are struggling with the burden of high drug prices. Drug prices rose 12% last year, twice the rate of medical inflation. Due to the high cost of medications, people often have to skip doses of their medications or forgo their prescriptions altogether. That's why it is so concerning that Big Pharma is looking to boost their profits even more by preventing or delaying generics from entering the market. They are seeking an exemption from a process known as inter partes review, or IPR, which provides a quick and low-cost way to challenge dubious patent claims. Today, I am proud to stand with the Alliance for Retired Americans, AARP Minnesota, National Nurses United, and the AFL-CIO Minnesota State Retiree Council to oppose Big Pharma's scheme. In 2012, IPR was passed in a bipartisan manner to shield against improper patent claims. In the first 2 years the process was in place, nearly 1/3 of challenged claims were canceled or removed. Many drug companies had questionable patent claims rejected in this process. Now they are seeking an exemption in order to maintain monopoly pricing. This would add between $73 and $220 billion in costs to Medicare, Medicaid, and consumers over the next 20 years. I am sorry I'm unable to be with you in person today, but I will be standing with you throughout this fight. Thanks for all you do on behalf of seniors and retirees. Together we can stop Big Pharma's scheme to further raise drug prices and maintain access to safe, reasonably priced prescription drugs for all Americans. Your friend, Keith. And now I'd like to introduce Will Phillips, State Director of AARP Minnesota.
Good afternoon. My name is Will Phillips. I am the State Director for AARP Minnesota, and I'm here today on behalf of roughly 652,000 AARP members in this state. And what we hear a lot when we're out around the state is about trade-offs. Trade-offs that if something gets too expensive, there is a correlation to something else that has to give, whether it's utility rates, whether it's your ability to pay those utility rates, whether it's housing, transportation, let alone leisure or enjoyment. And when we're talking about an issue like that, like this, that's really what it boils down to for us. It's too many Americans facing the impossible decision of paying for their skyrocketing pharmacy bills or figuring out how to buy the other basic necessities. And our members tell us that access to lower cost prescription drugs is a top priority for them and their families. And as far as we can tell, one of the most effective ways to keep prescription drug prices low is through the increase in the availability of low-cost generics. We applaud Congress, Congressman Ellison, Senator Klobuchar, certainly from the Minnesota delegation, for their efforts through the Bipartisan Patent Act of 2015 to address abuses in the patent system. However, carving out one industry, like the big pharmaceutical companies, is not only irresponsible, but it's really just flat out wrong. We are concerned that this will drive up costs not only for individuals, but if you look at the economic well-being of systems, key processes like Medicaid, Medicare, the more that we allow pharmaceutical companies to profit unduly on exclusivity periods, prolonged patents where generics could otherwise come to market, the more we're doing not only to harm the bottom lines of individuals, but also of key public safety net and healthcare systems such as Medicaid and Medicare. We're critically concerned there. We know that over the past 10 years, generic drugs have saved the U.S. healthcare system about $1.5 trillion. It's real money. It's real money to people. It's real money to Medicaid. It's real money to Medicare. It's real money to taxpayers, regardless of whether you have trouble paying those bills every month. So we do very much need to bring these products, these drugs, to market quicker as generics. AARP strongly urges Congress to exercise caution in making any changes to this IPR process that would make it more difficult to challenge weak drug patents. And we also ask Congress to fully consider the implications of an exemption for brand name drug manufacturers in terms of increased spending for payers. And again, all payers, individuals, Medicaid, Medicare, go down the line. So we very much appreciate the opportunity to speak to this issue. It's one that's of critical importance to our members. And with that, I want to introduce Jean Ross. Jean is a longtime Minnesota nurse, of course, very known by all of you here today, and a co-president of National Nurses United. Jean.
Thank you. As he said, I am Jean Ross from National Nurses United, and to my left is Linda Hamilton, your president for Minnesota Nurses. As sworn advocates for patients, nurses cannot stand by and allow the sick and poor in this country to suffer needlessly. We spend a great deal of time educating our patients on how and when to take their medications and based on their recovery plans. Now, if the pharmaceutical companies are allowed an exemption to the rules like this, then every other industry has to follow, and then patients just ignore our instructions as nurses because they can't afford to listen. We already hear from patients that can't afford the medications they are prescribed. We know very well there are patients who are either cutting their pills in half or taking them every other day to make them last. We're told by patients that they do this, and it rings false for us to say, no, you mustn't, when we know they can't afford it. They're just trying to make them last. Any exemption for the big pharmaceutical companies will only delay a cheaper generic form of that medication from entering the market. For many patients, that delay will be too late. Patients won't get better, they'll get worse, and they may go broke. One study by the Center for Economic Research estimates that on the low end, this big pharma exemption will cause drug costs to skyrocket to $73 billion over 20 years. That's the low estimate. The high cost scenario is Americans will pay $220 billion more. Now that cost isn't just borne by Medicare and Medicaid. It's a burden on real families. Elderly and middle-class families who are just one paycheck away from poverty every month. Now where's the exemption from higher costs for those people? So medications already cost too much, and we can't allow one industry with all its lobbyists to be granted an exemption that's going to allow those companies to keep the cost of life-saving medications, artificially high. And I thank you. I would like to introduce to you now Larry Kink. Larry's President, Education Minnesota, retired. Larry?
Thank you. I'm Larry Koink. I'm president of the almost 7,000 Education Minnesota retired teachers and ESP members also. I also serve on the board with the AFL-CIO Retiree Council, so we have cross connections there. When I was asked to come up here and say a few words, I thought, well, the person I should talk to is my pharmacist. because as a retired teacher, and I worked with elementary students for 32 years and high school students for 4 years, and I was a physical education teacher. So bee stings, of course, came to mind right away. And then thinking about other things like peanuts that cause problems. EpiPens have gone up about 700% in the last few years. And they only sell them now, I guess, in pairs. Some of these students have to have a pair in school. They have to have a pair at daycare. They have to have another pair if they have an activity after school. So look what it costs them, just those that need the EpiPen. And then insulin. Insulin has gone up a whole lot also. I think for a box of insulin right now is about $450. I'm not sure how long that lasts.
That's correct. That's correct.
Okay. Yeah. I thought this pharmacist would know. By the way, the drugstore I go to is Corner Drug in St. Paul. I live out in Egan, but being a good union person, I don't want to go to these big box places like Walgreens, and we don't have any individually owned drugstores where I live. So, but I take the time to drive into St. Paul for my prescription drugs, and most of my over-the-counter ones too. When we think of the students that have to spend the amount of money, or their parents have to spend the amount of money they spend for the drugs, because a lot of them, there aren't any generics. Or in the case of the EpiPens, some of the doctors will not write there is, I guess, one EpiPen out that's a generic, but some doctors won't write prescriptions for it. They make the families get the more expensive. Now, this is what my pharmacist told me. And the longer we put off letting these patents expire, the worse it's going to get. And it's not going to get better. And so we need to work with our congresspeople and say, hey, this is enough. Why don't we, one of my drugs said, he said, what we do need is Medicare for everybody.
That's right.
And until I had the discussion with him on Friday, I had no idea whether he was a Republican or a Democrat or what, but he let me know where he voted, and it's not for people like John Klein. I happen to live in John Klein's district. The best news I can give you about that is he's not running for re-election. So thank you for your time, and good luck with your conference here.
The issue is clear. Big Pharma is at it again. We need to go forth. We need to raise awareness of the particular issue on patents. We need to contact our members of Congress, both our strong allies and others. We shall go unmentioned. But yeah, we need to contact everybody. So thank you so much for being here today, and we'll see you down the road.